Hello, I'm Dr. Lisa M. Shaney, and today we're going to speak about sports medicine applications of homeopathic medications. My professional background has been spanned through many different areas in sports medicine and podiatric medicine. I attended Stony Brook University. My podiatric medical degree was at Scholl College, which is now housed at the Rosalind Franklin University up in North Chicago, Illinois. I did my residency at the VA Center in North Chicago, which is now currently called the VA Captain James A. Lovell Federal Healthcare Center. I am a certified athletic trainer, and that I had participated in athletic training when I was an undergrad, so I've been doing that for quite a few years, and I've kept up my certification. I've worked at the Olympic Games, the World Cup Games, I've worked at marathons, triathlons, I've worked at volleyball tournaments, many different types of sporting events, and I do cover quite a few dance company shows. I've covered some Broadway shows, and I do currently consult with many dance companies in the Chicago area. Love it, and it's been a lovely, wonderful thing for me. I've been working with DePaul University as their podiatric consultant since 1992, which has also been lots of fun and wonderful experience. I've lectured, and I've actually written 2 chapters in a sports medicine textbook that we have out currently, and I have students that come to see me and rotate with me at the office, both in the past medical students, medical doctors, as well as podiatric medical students. Some of the pictures that are on the slide are just some of my really wonderful experiences with my semi-pro football and some of the marathons. I've worked the Avon Breast Cancer Walk for many years. I've been able to work at the Olympic Training Center in addition to working at the Olympics in Atlanta. And the World Cup Games were really quite fun, and we're excited to have those back this June. So my background with homeopathy started a long time ago, about 26 years or so ago. In 1992, I was introduced to the products Traumeel and Zeel through a Podiatric Medical Association seminar, and I was really taken back by the information that I was given at the seminar and started to use Traumeel and Zeel in my practice and have really just never looked back. So it's been a very big staple in my practice for many, many years. I've used the topicals, I've used the oral medications, and I've used the injectables on a very, very regular basis, daily, actually. And I was offered the opportunity to actually go to the original Zeel company headquarters in Baden-Baden, Germany, to a fabulous seminar that was attended by many doctors and many specialists from around the world. So that was really a lovely experience. So Medi-Natura, the story and the mission is listed on the slide here, and Zeel started back with Dr. Reckwig, who was a modern-day physician and I believe died in 1989. He actually took the principles of homeopathy and combined them with modern-day medicine to create many of the products that we still use today. BHI Biological came in right about 1979, and that company had many different homeopathic medicines and remedies that they were using and distributing. And then in 2014, Medi-Natura actually opened up on the east coast of the country, and formally they purchased the USA Zeel subsidiary. So Medi-Natura's mission is to give millions relief without risk. So when we talk about homeopathic medications, typically we know that they have a really very, very good safety profile. And we like to tell patients that there is very minimal or rare risk. Their safety profile has been known for many years, at least anecdotally from my practice, using it for about 26 years. Generally, most homeopathic medicines are going to be plant-derived. There may be some minerals and there may be some extracts in the remedies as well and the medications, but generally most of them are going to be certainly all natural. The topicals, injectables, and orals can really be a lovely alternative to nonsteroidals, especially in patients that have issues with bleeding, or if they have stomach ulcers, if they take Coumadin or warfarin. This really can be a wonderful opportunity to give an alternative to your patients. So the homeopathic medicines that I use are a really lovely, safe and nice alternative to nonsteroidals. There's generally no drug-drug interactions, and we don't have to worry about bleeding issues if somebody's on Coumadin and warfarin, which really certainly can cause some issues. We can use them regularly, they can be ongoing, and the nice thing that we'll see in a moment is that we can use them regularly with patients for many different conditions. So patient perception is interesting. Although generally homeopathic medicines are considered maybe alternative in this country, they have been FDA approved for many years. Many patients that I see actually in my patient population may actually prefer natural alternatives, and I love the fact that I can actually give them that alternative. I would say that about 99% of my patients will happily agree to using my Traumeel or my Zeel injections versus a cortisone injection. It's very rare that somebody might have a concern or may want to look into the material that I give them. And generally when they come back, we usually will do an injection the next visit, and they do very well with it. So it's very rare that I have a patient that is not interested in trying the alternative. And once I do the care and use the medications, I find that most patients will really come back and ask actually for it time and time again. I have found that these medications have worked so well, and they have worked consistently through all the years I've used them, and I feel extremely enthusiastic to recommend them to all of my patients, young and old. So looking at the medications that we're going to talk about today, Traumeel is one. The medications that I use very regularly. So the method of action of Traumeel will help to prevent the pro-inflammatory lymphocytes from perpetuating that inflammatory reaction that we see. The lovely thing is that it works differently than the anti-inflammatories, which does inhibit the arachidonic acid pathway. So with the prolonged bleeding time that can affect many patients with aspirin and other types of nonsteroidals, you do not see that happening in Traumeel. So Traumeel has many botanical ingredients: aconite, arnica, the daisy, calendula, which is marigold. All of these few plants here on this slide all do different things, which we're going to see in a slide coming up in a few moments. And all of these different plants come in to that inflammatory response and will actually reduce either the neurogenic aspect of inflammation, or it will reduce the neutrophil migration. So we'll see that in a moment. Some more ingredients that Traumeel has is chamomile, yarrow, witch hazel, and St. John's wort, which is interesting how I love that they say that that's the arnica of the nerves, which really is a very common plant extract that many people do use. The other ingredients that are in Traumeel is belladonna, which actually Dr. Hahnemann, which was the founder of homeopathy many, many years ago, used that to prove and to treat scarlet fever. So that was a lovely experiment that was done many, many years ago when homeopathy was born. Echinacea, which many people use for colds and flus, and then comfrey, which is also a very good plant for tendons and bone and periosteum. The mineral components is hepar sulfurous and then the mercurius. And you can see the two pictures there. So that's what the two mineral components that actually round up all of the ingredients in Traumeel. So this slide is what we were talking about earlier. It modulates the vascular phase, the neurogenic phase. It helps to modulate the neutrophil and the lymphocyte migration. So the different ingredients in Traumeel are actually shown on this slide, and it is a really nice picture of how that works. So the method of action of Zeel actually works for more rheumatological type of conditions. Zeel inhibits a leukocyte elastase, which is released during the inflammatory reactions, which will ultimately damage articular cartilage. It actually stimulates lymphocytes to release the TGF-beta, which is a wonderful growth factor that we know about. It initiates changes that improve synovial fluid in the joint, which actually helps range of motion and helping to reduce stiffness. And it downregulates both COX-1 and COX-2, which is really interesting, which is similar to the nonsteroidals, but then again, you don't have to worry about bleeding issues or any other drug-drug interactions that you may experience with those other COX-1 and COX-2 drugs that are out on the market as non-steroidals. This is actually a nice diagram of how Zeel actually modulates that inflammation. In those gray boxes, you actually have the different components of Zeel, and it shows where those components work on that inflammatory cycle. So you see that there is some tissue acidosis, there's some free radical damage that comes in, and then there's tissue remodeling and tissue destruction that kind of go back and forth. And we want to make sure that we keep that in balance, certainly with sports injuries and other types of work injuries. There's going to be some natural degradation of cartilage, and we want to make sure that that always stays in a very good homeostasis type of situation. So what's nice about the Zeel is that it actually will help to keep all of that in balance by going through those areas of inflammation, similar to the diagram that we showed you for Traumeel, and it will help to keep that cartilage in good balance with its production of that tissue remodeling. So the method of action of lymphamycin, which is another injectable that I use, actually has a draining effect on the extracellular space. We know that the lymphatic drainage of our limbs is very important. We don't always talk about it in traditional medicine, but we always want to keep that lymphatic system working well, as it's really a very important detoxification center for our body. And the lymphamycin actually has a draining effect on that extracellular space. Toxins will accumulate in the extracellular matrix, and we want to make sure that if somebody has edema, or there's postoperative swelling, or there's swelling that's associated with any type of injury that somebody might experience from sports or whatever, we want to make sure that we can help to reduce some of that swelling by using the lymphamycin. The lymph vessels are supposed to eliminate a protein waste, and when it's blocked, we start to see swelling. And we want to make sure that if there's chronic swelling in an area, or even if there's acute swelling, we've had very good success with lymphamycin as an injectable. I have found it to be excellent postoperatively. I've used it numerous times when somebody has some acute or even chronic swelling in and around their incision site. I find that it can be injected really mixed with the Traumeel or the Zeel, and or alone, or just mixed with some lidocaine, and it really can be injected in most circumstances. So some clinical applications and some various sports conditions. I wanted to keep this section very generic because I'd like to make sure that if you're a rheumatologist, or you're an orthopedic surgeon, or you're an internist or a podiatrist, any of these protocols can really be we can approach these protocols in really any part of the body. And so I didn't really make anything very specific to a particular foot ailment, but yet wanted to talk about just generalized conditions that really any of us can use these medications for. So Traumeel and Zeel and lymphamycin all come in glass vials. We can traditionally mix them with 1 cc or more, to your choice, of lidocaine. I just traditionally use plain lidocaine, of course, but that certainly can be physician preference. I will use this to inject directly into tendons, tendon sheets. I use it for ligaments. We put it into joints, we put it into the capsules, and I use it in all types of subcutaneous tissues. Zeel, typically I will use generally more for joint and rheumatic type of issues, and I will inject them in and around joints traditionally. Lymphamycin, I will typically put right into the subcutaneous tissue. You can put it in and around a joint, and you can mix it with the Traumeel or the Zeel. So really anything is just based on your preference. It is something that can be done, although there are protocols, certainly there can be some variation based on your desires. So talking about acute sprains, whether or not we have a sprain of the lower extremity, and it certainly sprains can happen in the upper extremity, we know that sprains are going to present with short duration. They're going to be red, hot, and swollen, some bruising. If the lower extremity is involved, there might be some gait alterations, and certainly if patients are compensating, or they're not properly offloaded, or if they're not properly ambulating, they're going to potentially cause problems elsewhere up the chain. So typically when I treat acute sprains, I am very aggressive in a conservative fashion, of course. I believe that Traumeel works amazingly well with either using it as a ring the dragon type of protocol where you can raise small wheels directly around the joint, in and around the ligaments. You can use a half a cc or whatever amount that you feel that you would desire. The Traumeel and the lymphamycin can be combined very nicely in one syringe, or you can use it separately. I will inject directly into and around the affected ligament. And then it's always important, of course, as any sports medicine protocol, to always improve range of motion by helping to put compression in and around that area. That is one of the things that I'm very meticulous about. I feel that if the area is swollen, the joint range of motion is impeded, and even that extracellular matrix tends to get overwhelmed. I'm a very big proponent of using compression. I typically use ice short term. I always encourage patients to really watch their shoe gear. If we have to put them in a walking boot or a surgical shoe, if they have a very bad ankle sprain or midfoot sprain, that is very important as well. I'm also meticulous about getting into discussions of physical therapy treatments. Here in our office, we can do that, or certainly you can refer out as needed. I like to follow up on a regular basis after acute ankle sprains. I might have patients come in every 4 to 7 days, and we can repeat that protocol and make sure that we can get rid of that swelling, improve the function, range of motion, and get patients back on track as quickly as possible. I will repeat this weekly or even bi-weekly traditionally. For acute tendinopathies, again, this can apply to upper extremity as well as lower extremity. Generally, those acute tendinopathies will present with short duration. Certainly, we never know exactly when acute tendinitis goes to a subacute, goes to a chronic. Sometimes that can be something that we ponder a little bit as physicians and clinicians. But typically, the acute tendinopathies will have some of that post-dyskinesic pain. Getting up out of bed in the morning or getting up out of the car will cause some discomfort. We find that when I ask my athletes when they have that pain, is it early, mid, or during the end of a workout, or is it at the end of the day or in the next morning? Will they have that pain after they've worked out? So I find that getting that question answered kind of gives us a little bit better idea as if this tendinopathy or tendon issue is going from acute to subacute to chronic. And I feel that really when we talk about treatment, this can apply to shoulder tendons. And I always encourage my patients to ask their clinicians to maybe work with their rotator cuff injuries and some other injuries in their elbow or their wrist, and by using some Traumeel or Zeel as needed. But we will inject Traumeel directly into that tendon. I have had excellent success into the Achilles tendon, the posterior tibial tendon, anterior tibial tendon. Basically every tendon I have actually had good success with injections. So for treatment for acute tendinopathies, I generally will inject the Traumeel directly right into the tendon sheath. If I feel that there is a stenosing tenosynovitis, if we hear that crepitus and cracking into those tendons, I will actually put the Traumeel right into those tendon sheets. And sometimes you can add the lymphamycin as needed. I have found that for stenosing tenosynovitis conditions, the Traumeel works absolutely amazing. I will have patients call me a day or two later and tell me that the crepitus is either gone or nearly gone. And even if it's been there for a few days to a week, you can inject around and surround the tendon on the outside of the sheath as well. So really any protocol that you feel comfortable with works really well in and around those tendons. I will have them come in weekly, bi-weekly to have those treatments. We will always add, for the acute issues, some ice, some physical therapy, appropriate shoe gear. Again, at least for the lower extremity, I'm very meticulous about getting patients into the proper shoe gear as a very much important added treatment. And certainly cross-training. I see lots of runners and dancers, so we really have to try to encourage them to not run or jump or play sports that will continue to injure this tendon. I encourage everybody to cross-train and to continue to do many of their athletic activities, but really very important to cross-train and to modify some of those activities. The Traumeel and the T Relief products are fantastic as far as the topical applications go. I always encourage patients to take some home and use that topical medication as well. And I find that that really works well as a complete, full, well-rounded treatment protocol for these acute tendinopathies. So if we're going to talk about chronic sprains, and that unfortunately tends to be quite often what we all probably see more often, as patients will come in after weeks and weeks or even months and months of nagging, unresolved pain. I find that this will probably be the type of person I see probably almost more on a regular basis daily at the office. Patients will have that chronic morning stiffness. They'll have that post-dyskinesic pain quite often, and this may be 3 or 4 months after an injury. It's very important to evaluate and confirm that somebody really does have a chronic sprain. Quite often there can be missed fractures. So often I will use different radiographic modalities such as diagnostic ultrasound and certainly sometimes MRIs to evaluate for any type of fractures that may be occult that we're just not picking up. But having said that, certainly with chronic sprains, the treatment works really beautifully with Traumeel. I will get into a regimen once we find the diagnosis is set. If somebody has an injured tendon, I will directly inject the Traumeel into that tendon. We can do the ringing the dragon technique as well. We will add lymphamycin if there's still some swelling. And we will always start with some physical therapy treatments. I will certainly turn over to more of a heat and more of a chronic protocol regimen with some deep tissue massage, the appropriate shoe gear is very important again, and cross training, and certainly having patients come back on a regular basis, either weekly or biweekly, for sure, to make sure that we continue to get this chronic sprain feeling better by encouraging some inflammatory response there by doing more of a needling or prolotherapy type of protocol, which we'll talk about in a couple moments. So chronic tendinopathies is another thing that we generally all see. Many patients come in that have had injuries for many, many months. And so quite often those chronic conditions will ensue pretty easily with lots of our runners and athletes. So generally patients will complain of that, again, post-dyskinesic pain. They'll continue to have some morning stiffness. They'll really have difficulty in doing their normal activities. They'll have difficulty in running with any regularity. And so we really have to, again, confirm the diagnosis. I encourage everybody to consider using diagnostic ultrasound for tendinopathies. I find that that really is the superior method to evaluate even over MRI, I feel. But a lot of the things that we see in our office as podiatrists will be that plantar fasciosis. So quite often, most patients are not dealing with acute plantar fasciitis because they've been coming in to the office for either many months, or they are coming to us for the first time after having this condition for many months. So again, with the chronic tendinopathies, our treatments are going to be a little bit more on the chronic protocol. I'm going to use more of a fanning or a kind of a prolotherapy approach or a needling approach to the actual tendon or the plantar fascia or whatever we're working on. And the goal is really to recreate that acute inflammatory response, very similarly to using other types of injection protocols that are out there in the sports medicine world, like the PRP type injections and such. So if we're trying to encourage growth factors to come back in to set the stage for that acute response, Traumeel is a great medication to do that, because if we remember back, it's an inflammatory regulating drug. So we can encourage that inflammatory response without shutting it down like a steroid or like a non-steroidal. So that's where Traumeel really comes in and really fits the bill very nicely here. So we want to encourage the proper cells to come in to start that acute phase of that inflammatory reaction so that we can have a controlled version of that inflammatory reaction. And when we're encouraging the acute reaction to start, that's when us as clinicians need to make sure that patients are doing the proper shoe gear. They're not running, they're not jumping, they're cross training, they're modifying their activity, they're wearing the proper sleeves or braces or what have you if we need if that's necessary. It's not only important to encourage that inflammatory response when we know there's a diagnosed chronic tendon injury, that we always have to encourage that biomechanical or the orthopedic side of the picture with good shoes and cross training and really modifying the activities. So on this slide, this just is talking a little bit about that puncture phenomenon. So many of us do prolotherapy. We can call it needling, we can call it fanning, whatever you choose to call it. It really is something that we call the puncture phenomenon. And this actually creates local inflammation, as we just talked about on the last slide, by encouraging that new healing cascade. So when we talk about the puncture phenomenon, we know that when you introduce a needle into tissue, it will change the temperature. It will encourage that electrical potential to change and to start a new reaction. The needle effect will also release the opioid peptides, those enkephalins and endorphins, and it will start to encourage the traditional wound healing 3 phases, from inflammatory phase to the proliferative phase to the remodeling phase. And that's what we want, is new collagen at the end of the day. So my chronic tissue protocol will include injections on an every 2-week basis. We will have the patient come in for very deep tissue work, if you want to call it Graston or A-stim, but we'll have the patient do the deep tissue work. We will have them come in for the injection, and we will also do an ultrasound. And during the week, patients are, again, modifying their activity. They're wearing the proper shoes or walking boot or such. We're having them do heat on a regular basis. And so I find that all of those things encourage that acute response, and that's what we want to start, so that we can actually get back to that normal collagen 3. We don't want scar tissue. We want the better collagen to end up into that tissue. And I find that when you do this protocol chronically, and we do a series of them on an every 2-week basis, we can find over the course of 7 or 8 treatments that at that end of the treatment, we find that patients really do very, very well. And they come back and find that they can get back to running. They have no issues with their tendon or their plantar fascia or what have you. And it's really a very nice protocol that I have been doing for about 18 years now and have had excellent results. The very nice thing about this particular protocol is that it is traditionally, at least in the Chicagoland area, covered by insurance with a simple injection and some deep tissue work and some physical therapy treatments. We do this every 2 weeks, so really the time commitment for patients is very minimal. So it has a really nice effect in that respect. And to me, when I tell patients about this protocol, I always tell them that logistically it's a pretty simple protocol, but profoundly it has pretty great responses at the tissue level. So my chronic tissue protocol includes basically 3 things. I actually call it the triple header. That's just my funny little name for it in my office, so my staff knows how to schedule patients. Patients will come in and do some deep tissue work. Now, if you want to call it Graston, or if you want to call it A-stim, or just deep tissue work, it really is just a preference by the clinician. We'll have the patient follow that with a injection that I give them of the traditionally Traumeel. I will go into the actual area that we're working with, whether it's a tendon or a ligament or a capsule. We'll follow that up with an ultrasound here in the office. And then very importantly, I have patients use heat on a regular basis, 2 to 3 times a day. I will also always include all the orthopedic side of the treatment protocols, which really includes very good supportive shoes. If they need to be in a walking boot or a surgical shoe, that may occur as well, depending on their condition. And certainly I want them to modify and cross-train with their activities. And so I never ask my athletes to stop exercising, but I do ask them to modify and cross train. So I think that it's a very important modification, and it's a very important compromise that my patients have to make. And I do have that serious conversation with them. And my goal is to get the collagen back on track and to help the immune system to do that work for me. I'm just the messenger, and the immune system is doing all the work. One more note about the chronic tissue protocol. As we know, there's many types of products out on the market that have been really very successful for many of us. The PRP injections and the stem cell injectables that are coming out on the market these days. A lot of us are either trying them or we're hearing about them. And those are all fine and dandy, and I'm sure they work great, as I've used some of them in the past. However, they're costly. They're not always covered by insurance. And the nice thing about the Traumeel is that when you do a prolotherapy or a needling approach to that tissue that's damaged, chronically damaged, the beauty is that you can do it right in your office. You do not have to have special equipment. You do not have to have special injectable solutions prepared. As we know, those solutions are wonderful, but they are costly, and quite often patients cannot afford to have you do that for them, or it's not covered by insurance. So when we use Traumeel and or Zeel in those chronic protocols, they work really well, and it's covered by the insurance when you're billing for the injection. And certainly we can couple that with the other treatments that also encourage that inflammatory response to actually turn on that immune system to get that collagen back on track. So I encourage you to think about that when you're doing these treatment protocols. And another condition that we see quite often, and some of us clinicians may see more than others, depending on what body parts you typically work with. Trigger points can occur in any muscle of the body, upper extremity, lower extremity. We see it, and I'm sure we've all experienced it ourselves. The nice thing about Traumeel is that you can actually use the Traumeel directly into those trigger points. And some of us might be doing needling techniques or protocols for trigger points. Some of us might be having our staff do acupressure points or deep tissue work in those trigger point areas. But the Traumeel injection really works well to help kind of destimulate that little hypersensitivity area that we often think of as a trigger point. It's not an uncomfortable injection, and really depending on where the trigger point is located, traditionally it's pretty easy to get into with a simple injection. I will certainly inject with my Traumeel. I will use some of the lidocaine as we've done in the past slides, usually 1 cc. And you can either do a single injection, you can do multiple injections in and around different trigger points, depending on how many that you suspect. And the addition of massage and, again, some of the orthopedic treatments with good shoe gear, cross-training, modification of activity, I find that depending on the conditions, certainly heat or even sometimes ice might work nicely. And I also do a lot of kinesiotaping, so I find that kinesiology tape works very, very nicely as well. And I always encourage people to take home the topical T-Relief or the Traumeel creams as well. So the Traumeel injections really work well for trigger points as well for those patients that are having some problems. So I would definitely encourage you to try that. So when we're talking about joint and cartilage issues, osteoarthritis, even avascular necrosis conditions that we see in the podiatry world, traditionally we see a lot of that happening at the second metatarsal joint called Freiberg's disease. I have had very good success with using Zeel in those types of applications. Certainly pre and post-operative injections have worked very nicely. The company has just finished a wonderful study with a number of orthopedic surgeons and a number of patients on knee arthritis using Traumeel and Zeel. So please ask your representative about that study, but that was just shown to be very effective. But I find that using Zeel into those joints really works beautifully on the cartilage production and helps to reduce the destruction of the cartilage by encouraging that hyaluronic acid to be produced. I find that multiple injections, maybe on an every 2-week basis, works really nicely on this type of protocol, either for osteoarthritis or avascular necrosis. I find that it works beautifully in addition to using the topical cream. So I encourage your patients to try that T-Relief mobility cream as well, and to also always watch shoe gear to make sure biomechanically patients are lined up properly. If they have a leg length discrepancy, give them a lift. If they have a foot that's pronating, support that foot so that their knee doesn't turn in. So I'm a big proponent of utilizing the biomechanical treatments as well as the inflammatory treatments. In my practice, I always discuss the two-pronged approach to healing patients, short-term and long-term. It's got to include both the mechanical treatments and it's got to include the inflammatory treatments, whether we're trying to reduce some of the inflammation for those acute conditions or we're trying to stir up those inflammatory conditions for those chronic tendinopathies or chronic pathologies. So I find that certainly using the orthopedic aspect of treating is very important, and sometimes that gets missed. And so I encourage you to really look at both prongs of treatment protocols to really get the best holistic and the best well-rounded treatment protocol for your patients for their conditions. Typically with the AVNs and osteoarthritic issues, I will typically have patients come in either weekly or bi-monthly typically. Certainly sooner and earlier is certainly fine if that's what you feel is necessary. But in my practice, I typically have them come in maybe once every week or every 2 weeks. So I hope that this has just given you a glimpse into how I treat lots of my athletes and my everyday patients that come in. It's been really a pleasure to work with these products over the many years, even though the names might have changed and the companies have tweaked a little bit. The products have stayed the same, and it absolutely has been a phenomenal addition to my practice, and I will continue to use it until the day I retire. So I hope that these give you some ideas, and I encourage you to try some of these protocols and work with patients with these medications. You will see how fantastic they work, and anecdotally, I can tell you that these medications are the best medications I've ever used for patients and for their conditions. So we'll get into some questions and answers now, and so I hope this has given you some good food for thought. Thank you.